Dear audience, it's Mahfuz Mishu. Welcome you to this very special interview show, and I am delighted to host Neely Daniels. She is the country director of US Center for Disease Control and Prevention, CDC. You know, CDC is very popular to the Bangladeshi people, especially during COVID. It's almost 2.5 years your journey here in Bangladesh. The first question I would like to hear from you, the answer here from you, what are the CDC's observation about the public health scenario here in Bangladesh?
Yes, thank you so much for having us here today, Mr. Mishu. I'd like to start with just talking a little bit about what the US CDC is. So we're the Centers for Disease Control and Prevention, and we are the public health agency of the United States of America. Here in Bangladesh, we are part of the US Embassy, and we have been working in Bangladesh as long as it's been a country, and really going back to the early 1970s, and the US government brought hundreds of workers to help eradicate smallpox here in Bangladesh. That was a huge public health success for Bangladesh, for the whole world. And I think that there have been other...
in early 1970s.
Early 1970s, correct, when it was the last case here in Bangladesh in a 3-year-old girl. And since then there have been other really impressive public health achievements. I think childhood vaccination, particularly in Bangladesh, is very good, as is family planning. But one of the things that we are faced with in Bangladesh is that, and everywhere else in public health, is that there are constant threats. And health threats are always changing, and we have to be ready for them. So, as you mentioned, we had COVID-19 pandemic, and countries all over the world were fighting it. And we were very happy to be here in Bangladesh to work on that. But we're really happy to be here in the future too. We're not going anywhere to continue to help protect the Bangladeshi people and work alongside our partners here for whatever public health threats there are in the future.
Yeah. So how do you feel at the present situation of public health in Bangladesh? You know, it's almost 52 years of journey of as an independent country, and you are our partner from the very beginning.
I think it's always changing. It's public health is, I don't know anywhere where there are ever adequate resources, and so we're always making decisions in public health. And so we have to, as governments, look and figure out what are the most important issues and try to deal with them. And so it's evolving, and I think that there have been a lot of improvements, but like every other country, there's always areas that we need to strengthen, we want to strengthen, and so we're working on those things together.
Okay. Madam, I would like to ask you how we can, United States and Bangladesh can working together to improving the public health scenario in Bangladesh?
That's a great question, and I think the first thing that we can do together is to continue working together. We have lots of different activities that we're working on to improve public health here in Bangladesh. One of them is regarding the Nipah virus, and CDC has been working with IEDCR and ICDDRB since the very beginning in 2001, when it was first discovered here in Bangladesh. It's a very serious virus. It is carried by bats, so the big flying fox bats that eat fruit, and they like sweet things, and so they will drink the raw date palm sap as it's being collected, and then sometimes their urine will actually get into those collection vessels. And so when a person drinks the raw date palm sap, then unfortunately that's how they can get infected with the virus. And it's not the only way, but research that was done between our institutions showed that drinking raw date palm sap is the single most important way that Bangladeshi people get exposed to the Nipah virus. And so I know that we're coming into the raw date palm sap season, and it's very popular, and it's
very tasty.
It's very tasty. It's a traditional delicacy, I know that. But unfortunately, when it is taken raw, that is when it can be dangerous to people. And it's a rare disease, but among the cases that we know about in Bangladesh, over 70% of people have died who have gotten this. So it is unlikely, but it is very dangerous if you get it. And so my request would be that people please cook the date palm sap. I know they don't want to, but to cook the date palm sap before they take it.
As you are staying in Bangladesh for last 2.5 years, you know, dengue outbreak is now a serious health concern for Bangladesh. Even in the starting of winter, people are dying from dengue. So do you think Bangladesh is in the right track to prevent this kind of disease like dengue?
So there are many things. Dengue it's a very, very serious disease, and this year in particular, there are outbreaks happening in countries all over the world, I think at a level not seen before. It has been a very difficult year for dengue in Bangladesh. My colleague, Dr. Hasibur, will talk a little bit more about it, but I do want to say that when I was in graduate school working on my doctorate in epidemiology, I worked in mosquito control in the United States. So I was out in the forests and with the water and looking for mosquitoes and testing for them and trying to control them. And we have the same kind of mosquitoes in the United States. And these mosquitoes are extremely difficult to get rid of. Dengue is not going away in Bangladesh. It will be here next year. And it hasn't gone away yet this year. And so it's very important that we all do everything we can. And I think everyone has a part to play with regards to these mosquitoes. So they bite all day long, not just at night. And so it's a little bit harder to protect ourselves during the day, but they bite all day long, and they actually prefer people. So they won't bite animals, they'll actually look for people to bite. And then the other thing is they actually only need a very small amount, just a few milliliters of clear water. And so anytime it rains, any small amount of water, there can be a new generation of mosquitoes breeding. So it's important that we dump out that water every few days if there's any collecting around our homes.
So do you think Bangladesh is on the right track to prevent this?
I think that Bangladesh is going in the right direction. I think it's going to be very, very difficult to control because we have to try to control it from all different levels, from patient care to mosquito control, everything we can do, but it's going to be very difficult.
Yeah, and you know, public health sector research is very important, and in Bangladesh, how do you evaluate the research situation here in Bangladesh in the public health?
So there's a lot of really good health research going on in Bangladesh, and the USA is a partner in quite a bit of it. One of the projects that we're working on that is one of my favorites actually is with ICDDRB, and for many years we've been doing trials for poliovirus vaccine. And so whenever there's a new version of the vaccine that comes out, we're working with ICDDRB on these. Then what we're doing is we're looking into see what the dose should be for children, and then how many doses and how often those doses should happen to be most effective. And what I really like about this research is that it not only protects the Bangladeshi people and the children of Bangladesh, but it also protects its information that's used all over the world. It can protect children everywhere.
My last question would be about health expenses. You know that treatment expenses is very high in Bangladesh in compared with other countries. So what may be the reason behind it, and do you find any solution of this kind of program? Will you have any suggestion?
I'm going to address this from a little bit of a different angle and talk just a bit about public health. So when we think about health care, we're usually thinking about a physician and a patient interacting with each other, and the physician is trying to cure the patient, either heal them from an injury or cure them of an illness. Public health looks at a little bit more at a society level and is focused on trying to help people live longer lives, live healthier lives, lives that are free from disease and that are free from early death. And so there's a lot of different pieces of public health. So there's nutrition is a big one. As mentioned, there's vaccines, there's family planning, there's environmental health is a big piece. So that's having clean air and clean water. There's also our relationship to animals. And so that's as wildlife, it's as pets, and it's also as either livestock or food. So all of these things and others really contribute to what we consider public health. To get back to your question, the thing that's most important, I think, about public health is that it's always easier to prevent a disease than to cure it. Yeah. It's always less expensive to prevent a disease than to cure it. And so what the US CDC is here doing as part of the US Embassy is trying to help Bangladeshis prevent disease. We want to prevent disease in Bangladeshis so we don't have to cure them in the first place.
Okay, thank you, Dr. Nilikedos, for your valuable time, and hope you will have good time here in Bangladesh.
Thank you so much. We're very much enjoying it. It's wonderful to be here and appreciate you having us here today. Thank you.